Hi, I'm Dr. Usha Kiran. I'm a consultant obstetrician and gynecologist. In this video today, I will be talking to you about the routine pregnancy care you will be receiving. First of all, congratulations, you're pregnant. Duration of pregnancy and expected date of delivery. Normally, pregnancy is of 40 weeks of duration, which is 9 months and 7 days. So the due date is calculated by adding 7 days, 9 months to your last menstrual period. That's the first day of your last menstrual period. So if your last menstrual period was 1st of January 2019, your due date would be 8th of October 2019. This due date is now matched with the scan due date, which is confirmed at around 12 weeks. If there is more than a week discrepancy between the due dates calculated by the ultrasound scan and by your last menstrual period, then we actually stick to the one calculated by the ultrasound scan because that is much more accurate. Now, this due date will not change in future with the subsequent scans. The subsequent scans are meant only for assessing the well-being of the baby and the growth. Only 4% of the women actually deliver on the due date that we give them. 50% of them deliver either 2 weeks before or a week after the due date. Checkups with your obstetrician. You will be visiting your obstetrician starting from 12 weeks every 4 weekly until your 28 weeks. From 28 to 36 weeks, you'll be visiting every 2 weekly, and then from 36 weeks onwards, every weekly till you deliver. During these visits, your weight will be checked, your blood pressure will be checked, your urine for any protein will be checked, and your baby's well-being and growth also will be assessed. Routine tests during the pregnancy. At 12 weeks, when you have your booking visit, you'll be having your booking blood tests, which will include a full blood count, your blood group and type and antibodies, your rubella immunity, infection screen, and your thyroid testing. The full blood count and blood group antibodies will be repeated at around 28 to 32 weeks again. At 24 weeks, you'll have your glucose tolerance test to check the diabetes status. This test consists of 3 samples, one taken 8 to 10 hours after fasting and the other 2 taken an hour and 2 hours later after having a glucose drink. At 36 weeks, a vaginal swab will be taken to check for any streptococcus infection, and if you're found to be positive, you will be given antibiotics in labor to prevent this infection from going to the baby. Ultrasound scans. You will have one booking scan at around 12 weeks, which is the dating scan, which I mentioned earlier. You will also have another anomaly scan, which is around 18 to 20 weeks, which looks at the detailed organ development of the baby. Any further scans might be done depending upon the necessity. Additional tests. You will be offered at around 12 to 14 weeks additional tests for Down syndrome screening, in the form of a blood test, which is called the double marker test, which tests your biochemical markers and predicts the risk of Down syndrome, and also an ultrasound scan, which is called the nuchal translucency scan or the NT scan, which looks at the fluid level in the nape of the neck of the baby. These tests are not mandatory, they're optional, and to know more about Down syndrome screening, you can watch my video titled Down syndrome screening in pregnancy. Medications during pregnancy. You should be taking folic acid 3 months before you get pregnant and for the first 3 months of the pregnancy. If you're obese, if you're taking any anti-epileptic medications, if you're diabetic, if you've had previous neural tube defects in the baby, you will require a higher dose of folic acid. You will be given iron, calcium, and multivitamin supplements throughout the pregnancy, starting from 12 weeks, as the baby needs these supplements. You will also be given a BOOSTRIX vaccine at around 28 to 32 weeks, which helps to prevent certain infections in the baby after it is born. If you are Rh negative, you will require to take an anti-D injection at around 28 to 32 weeks and repeat one after the baby is born. Any other medication, if you have to take in pregnancy, please consult with your obstetrician before you take them, because not all medicines are safe during pregnancy. Common ailments or symptoms during pregnancy. Nausea and vomiting is the commonest of all the symptoms that you get in pregnancy. Almost everybody suffers from it. It usually is there within the first 12 weeks of pregnancy and gets better after 12 weeks. It's much more during your first pregnancy as compared to the subsequent pregnancies. Usually does not require any medication, but sometimes you might require medications to control it if it's severe, or might even require hospitalization to improve your hydration if you've not been able to take anything and have been continuously vomiting. Backache, pain radiating down the hip and leg, and pubic symphysis pain at around the pubic area below the bikini line are common pains that you get in pregnancy. There isn't a lot that we can do about treating them apart from doing a few yoga stretches, which tends to help them if not completely control them. To know more about yoga during pregnancy and childbirth, kindly watch my video titled Yoga During Pregnancy and Childbirth for more information. Baby movements and heartbeat. Baby's heartbeat is visualized on an ultrasound scan at around 6 to 8 weeks and can be heard with an external transducer from around 16 weeks onwards. Baby movements are seen as early as 9 to 12 weeks on the ultrasound scan. However, you will only be able to feel it from 22 weeks onwards. Position of the baby. The baby being head down is the most favorable position for the baby for you to have a normal vaginal delivery. However, during early pregnancy, the baby keeps moving and kicking around, so the position is not that significant. Only after 34 weeks is when we start looking at whether the baby's position is head down or not. If it is not head down, you might have to discuss further regarding the mode of delivery with your obstetrician. Braxton Hicks contractions. These are uterine contractions which can be felt usually after 24-28 weeks or more towards the end of the pregnancy. They are uterine contractions, but they're painless and they're harmless. So as long as they're painless, there's nothing to worry about them. If at any point they get painful, if you're having bleeding or any discharge, obviously you need to see your doctor. Lightning effect. At around 36 weeks, if it's your first pregnancy, you'll suddenly feel that the baby has moved down a little bit and the pressure that was pushing on your chest has actually relaxed. This is called lightning effect. This is a good sign and signifies that the baby is actually getting into the pelvis, getting ready for delivery. If you don't feel the lightning sign, not to worry about it. It can still happen at a later stage. Lightning effect is seen only in the first pregnancy. In the subsequent pregnancies, the head does not get into the pelvis until the woman is in labor. Diet during pregnancy. Pregnancy is a physiological condition, so there are no diet restrictions as such unless you have any other problems complicating the pregnancy. However, I suggest that you avoid eating food delivered from outside, frozen foods, ice creams, cheeses, because these are the ones which can actually give rise to certain infections and might affect the baby and the pregnancy. Exercise during pregnancy. Again, pregnancy is a physiological condition, so you can continue to exercise as you were doing before. So walking, running, swimming, all that is acceptable. Except do not use heavy weights in the gym. Travel during pregnancy. Most of the airlines allow you to travel up till 36 weeks during pregnancy. As long as you're fit and fine and your doctor gives you a travel certificate, you can fly before 36 weeks. Warning signs during pregnancy. If you have any of these signs, you need to see your obstetrician immediately. Abdominal pain, headache, visual flashing lights, dizziness, bleeding vaginally, vaginal discharge, foul smelling or watery, fever, any fall on the abdomen or any trauma to the abdomen, or if the baby hasn't moved for 3 hours at a stretch at all, or less than 10 moments during the day, you should be seeking help immediately. We also run an antenatal or a parent craft class every monthly, which gives a lot of information about childbirth. So I would suggest you attend at least one of them during the pregnancy with your partner if they're willing to come. They're free of charge. We also have stem cell banking facilities for the cord blood of your baby. So if you would like to know more about it, please watch my video titled Stem Cell Banking. Kindly check the information part of this video for a link to my blog, Dr.Usha Kiran, blogspot.com, and the Facebook link. And you can contact me on my WhatsApp number 0091 720 801 2411 for any further queries.